Hello guys. So now we shall be discussing regarding the anatomy of the nasal cavity. Okay, so our topic of discussion would be regarding the nasal cavity. So when it comes to the nasal cavity, few important things you need to know. First of all, let us write down some of the basic functions of the nasal cavity. The first important function is that nasal cavity is responsible for humidifying the air, right? So it warms and humidifies the inspired air inside. So it warms and humidifies the inspired air. Warms and humidifies the inspired air. What is the second important? The second important thing is that you have got a lot of cilia within that, right, within the nasal cavity. So whenever you inspire any air, and if in that air if there is any pathogen or any dust material, with the help of that cilia, by a reflex called as sneezing reflex, all the pathogens are expelled outside. Okay, so it removes and traps the pathogen, not only the pathogen, and also particulate matter. From where? From the air where you have inspired. From the inspired air. From the inspired air. Third important thing is that nasal cavity is responsible for the sense of smell. It is responsible for sense of smell also, right? Right, next important thing. Fourth important thing is that in the previous videos of paranasal sinuses and all, I told you all the sinuses will drain into the nasal cavity only. Within the nasal cavity, you have got superior concha, middle concha, inferior concha. You know that, right? So these sinuses are draining into these concha. So can I also tell that nasal cavity is responsible for draining the paranasal sinuses? So it drains and cleans the paranasal sinuses. Cleans the paranasal sinuses. Not only sinuses, even you have got ducts. What ducts that are attaching all the way from the lacrimal gland to the nose? That is your nasolacrimal duct, right? And the lacrimal ducts also. Lacrimal ducts. Okay. So these are the four important functions which you can see. It warms and humidifies the inspired air. It removes and traps the pathogens and particulate matter from the inspired air. It is responsible for the sense of smell. It drains and cleans the paranasal sinuses and the lacrimal ducts. Now, if you look at the wall, this is called as a medial wall of, or the medial septal wall of the nasal cavity. Now, within this medial septal wall, if I am drawing a line over here, right, if I am drawing a line over here, so this entire part which you can see here, right, so this entire part is called as a olfactory region. This entire region is called as your olfactory region. After the olfactory region, the rest of the region which you can see, right, you see this part over here, the rest till here, right, so this part is called as a respiratory region. So how many regions you have got? You have got olfactory region as well as you have got respiratory region. And next in the front over here, you see this particular region over here. This is what is called as your vestibule. This is what is called as your vestibule. And next, this part which you can see over here is called as your nasopharynx. This part is called as your nasopharynx. Next, you see this opening here. You see this tiny opening here. This tiny opening is nothing but the opening of the auditory tube. You know, auditory tube or eustachian tube or the pharyngotympanic tube, right? So that is the opening of that. So it is the auditory tube opening. Auditory tube opening. Okay. Now, important thing you have to know that what is the importance of this olfactory region? Olfactory region is the one which is having olfactory receptors. Olfactory receptors, as all of you know, olfactory receptors, they take the sensations of the smell, right, and then from there with the help of the olfactory nerves they take up to the frontal cortex there. Okay, you have got olfactory bulb and all, so there it will take these sensations, right? Now, important thing you need to know is that here I talked about the respiratory region, right? I talked about the respiratory region. Now, in this respiratory region, the epithelium which you can see is called as ciliated pseudostratified epithelium. Ciliated pseudostratified epithelium. Ciliated pseudostratified epithelium. Okay, so this is the epithelium which you basically can see. So this is all you need to know regarding the nasal cavity, guys. Thank you so much for watching my video. Goodbye.